Hi, I'm Dr. Kenneth Thean, and today I'd like to talk about periorbital rejuvenation or aesthetic treatments around the eye. The eye is a very important part of the face, often overlooked, and improvements in the appearance of the eye makes a huge difference to the appearance of your face. I like to divide the eye into the upper, the eyelid and the eyebrow, droopy eyebrows, the sides of the eye, crow's feet, the wrinkles that we normally see as we get older, and beneath the eye, which are dark eye circles, sunken eyes, wrinkles underneath the eyes, eye bags, and small little bumps, oil seeds that appear as bumps beneath the eye. Now let's talk about Milia seeds, which are these bumps. They're the easiest to treat. Take an ablative laser, remove each one of them one at a time, and the skin is smooth again. For treatments above the eye, droopy eyelids and hooding of the eyelids are best treated with plastic surgery. However, for those who don't want to go underneath the knife, there are some non-surgical options available. Because the skin around the eye is very thin, it requires a multifactorial approach. First, I like to use lasers to resurface the skin, tighten the epidermis, and a laser that goes deep into the dermis and stimulates the production of collagen, and that firms and tones the skin. I can also treat the area above the eye, the forehead, and that lifts the eyebrow. If that's not enough, I can add radiofrequency and high-intensity focused ultrasound or HIFU, and that gives me better results. I can also treat the area above the hairline, and that gives me an added lift. Side of the eye, the crow's feet are also very easy to solve. It's caused by overactivity of the orbicularis oculi muscle, the muscle that helps close the eye. Now, overactivity of this muscle creates these wrinkles called crow's feet, and just by injecting a small amount of neuromodulator, it relaxes the muscle and the lines become much less. It requires to be repeated every 4 to 6 months. Problems underneath the eye. Dark eye circles, very common, caused by too much pigmentation, usually caused by rubbing the eyes, dilated blood vessels, thin skin, and loose, lax skin. Therefore, in order to treat this condition, it requires a multifactorial approach. I start with a pigment-reducing laser that reduces the pigmentation underneath the eye. I add a vascular laser to shrink the blood vessels. Then, a skin resurfacing laser for the epidermis tightens the epidermis, and a laser that goes deep into the dermis stimulates the fibroblasts to grow collagen, and this tightens, thickens, and firms up the skin. Sunken eyes, I take the same approach. However, sunken eyes requires more treatments, and I have sometimes to add radiofrequency and HIFU, high-intensity focused ultrasound, to grow more collagen and improve the appearance. A quick way out is to inject fillers underneath the eye. It's temporary, lasts about a year, and some patients really don't want to be injected underneath the eye. Wrinkles underneath the eye, same approach. Treat the epidermis to smoothen the epidermis and the dermis to thicken and firm the dermis. But I need to spend more time on the epidermis to resurface it because the wrinkles are deeper there. Eye bags. Eye bags, big eye bags are difficult to treat, and the best option is surgery. However, for those who don't want to go underneath the knife, there are non-surgical options available. Eye bags are caused by herniation of the pad of fat underneath the eye forward because the skin is loose and lax. What I do is I take the same approach to try and tighten the skin and also to try and shrink the fat. Research has shown that if I can heat fat underneath the skin over 45 degrees for more than 3 minutes, then 40% of the fat cells get damaged. So, That's what I do. I use a laser and heat that fat up for more than 3 minutes, and I get good results with that. I have to also add radiofrequency and HIFU for big eye bags.